From Yellowhammer News, this is One Day at a Time, presented by Longleaf Recovery and Wellness. Join me, Laurie Dhue, as I speak with industry leaders about the challenges and solutions surrounding substance use disorder and mental health issues facing so many people here in Alabama. Hi, everyone. We are putting a priority on having important conversations about substance use and mental health in Alabama. I'm your host, Laurie Dhue, and I have 17 years of continuous recovery. Joining me today is Kim Boswell, Commissioner of the Alabama Department of Mental Health. Commissioner, thank you so much for joining us today.
I'm so excited to be here today. Thank you for the invitation. Really looking forward to our conversation.
I am too, because I know that this conversation is going to provide important information for our listeners. And you also have an interesting story yourself, which we'll get to in a few minutes. But first, I'd like to know how you would describe the state of mental health services in Alabama right now.
So I think the best description right now is we are going through a major transformation of services in our state. We've been doing that really for the last 4 years. Building out what we call the Alabama Crisis System of Care. And why that's really important, really up until really 4 or 5 years ago, if you needed mental health care or substance use treatment, you were likely going to be put on a waiting list or be told that unless you were a danger to yourself or others and willing to go through a civil commitment proceeding, there really wasn't a bed for you. And so it's really, really important to have crisis services available to people when they're in a mental health crisis. And so much of what we've done over the last 4 years is about transforming those services so that people have someone to call, someone to come to them, or somewhere to go if they're in a behavioral health crisis. And the someone to call is the new 988 crisis line. So often in the past, if people were in a mental health crisis, they would dial 911.
Yes.
And so, of course, what you get if you dial 911, you get EMS, you get law enforcement, and there really are only two places they can take you. One is to jail and one is to the emergency department, where you may wait for a long time before you get mental health care.
And that is not necessarily where you need to go.
Correct.
Jail or the emergency room.
Right. So our whole Alabama Crisis System of Care is really focused on outcomes of keeping people out of jail, keeping people out of emergency departments where they're often boarded for a long period of time and not able to get the care they need. And so 988 is the entry point into our system now. You don't have to try and remember the names of all 19 community mental health centers or what substance use treatment program is near you. You can just simply dial 988 and find out all of that information through that line and actually even get some counseling as well. A lot of times people can resolve those issues on the phone. If not, the someone to come to you is a mobile crisis team.
Wow.
Yeah.
Gosh, that seems so practical and it makes so much sense. Someone actually comes to you?
Right. So we can deploy a mental health professional on that team. There's usually a peer support specialist that has lived experience. We can even co-respond with law enforcement. If law enforcement has identified a call where they know it's really a mental health issue, we can deploy a mobile crisis team with law enforcement so they can address that issue. It's really helpful in our rural communities where access to care is a real issue. And then, of course, we have the Someplace to Go, which is our 5 crisis centers that we've opened in Alabama over the last 4 years. Those centers are in Huntsville, Birmingham, Tuscaloosa, Montgomery, and Mobile.
So you've got the whole state covered, literally from top to bottom.
Hopefully. We do know that we need more crisis centers. We are opening a crisis center this fall in Dothan. If you've ever been to Dothan, it's hard to get from Dothan to anywhere. And so it's a little bit of a geographic island. And so we feel like having that center in Dothan is really important. Those centers do provide crisis stabilization services. So it is potentially a 5 to 7 day stay so that you can be stabilized and then, if need be, triaged to other services. The whole goal is trying to prevent folks from getting to that point of a civil commitment proceeding where they're having to go through the probate court and have, in essence, their civil rights taken away in order to get treatment.
Could you go into that a bit more, this civil commitment? What does that mean for the layperson who might be listening who does not understand what that means?
So often we have a situation where someone is not willing to seek help.
Right. Is that out of fear, or is that because of a mental health condition, or for various reasons?
Really kind of both.
Okay.
Often people they're fearful of going into a hospital setting. Certainly fear plays a role in that, but there are mental health conditions where people don't really believe they have a mental health condition. It's not like addiction where we think of they're in denial from their addiction. It's really literally they don't believe they have a mental health issue. And if you ask them to take medication, it's a little like if I told you were diabetic and you need to take this insulin and you didn't believe you were diabetic, you wouldn't be taking the insulin. And so there's a core group of people, particularly folks with bipolar disorder as well as schizophrenia. About 50% of those individuals do not believe that they truly have a mental health issue.
Right.
So often they go back through our system multiple times because they stop taking their medication. So there is a group of people who cycle through that civil commitment proceeding. But really what we saw in our state too is we saw so many people where families were just so desperate because they didn't know how to get them help and they couldn't find help in the community. And so that was really a big part of the reason we developed the crisis centers, because in a lot of those situations, if they had been able to access care earlier, we could have prevented that civil commitment.
Speaking about my own experience being in recovery from alcoholism, that earlier intervention is so important. You know, I always say, gosh, I wish I had gotten sober earlier in my life, but it takes what it takes. And I think that is so important when you're talking about mental health issues or substance use issues. The earlier you can intervene, the better the outcome.
Right. We know, like, even with kids, like 50% of the kids that are going to be eventually diagnosed with a mental health issue really can be identified in that 12 to 14 age group. And so we do talk a lot about how important it is with our youth to educate them about mental health. I remember talking to a student at UA who was in the Blackburn group, and she said, you know, it took me going to college to realize that feeling that I had all the time, not everybody else had it. And finally I could put a name to it, and it was anxiety. And she said, you know, I realize now that age 9 or 10, I was feeling that, but I didn't have any words for what I was experiencing. And then, of course, often what happens is if young folks are experiencing that, then they often turn to alcohol or drugs to try and self-medicate and make them feel better. Whereas because they don't have the words, like they don't know about anxiety or depression or some of the other kind of mental health issues that happen.
And so they self-medicate with substances, right? I also think that parents don't know that their children's brains aren't fully developed until they're 25.
Right.
And they may think, well, my kid is 18, they're going off to college. They're an adult now. They can handle these things. Or my child is 21, they can legally buy alcohol, vaping devices, and in states where it's legal, marijuana. They're an adult, they're fine, but that's not the case.
No, often they really don't have any idea how it's impacting their brain and their brain development. and how it negatively impacts their brain development. I have this conversation with my grandchildren all the time because it's like I have a 16-year-old and he starts talking about vaping, and I'm like, and so I launch into my, do you know what that's doing to your brain?
Yeah.
Like maybe you want to wait and not do vaping. That's not good for you. So those kind of conversations, we just weren't educated. It's certainly my generation. We were not educated about brain development. And now we know so much more about how all of those things impact the developing brain, whether it's the birth to 5 group and how trauma impacts kids who are, growing up in a violent or traumatic situation. And then with teenagers, just how important it is to know about that brain development and know what's having a positive impact and what's having a negative impact.
Let's talk about the opioid settlement fund for a moment. If Alabamans aren't familiar, there is a fund out there that the opioid industry has given each state a certain amount of money to quote unquote compensate, even though you really cannot truly compensate for dead people, dead or severely damaged from opioid overdoses. But if you could just speak about the appropriation that Alabama has received from the opioid settlement fund. I think it's $3 million or more than that?
It's actually more. The first round, I think, was around $10 million.
Oh.
So last fall, we actually put out an RFP. 8.5 of that $10 million came to the Department of Mental Health. So we issued an RFP and asked for people to respond to that RFP in really 3 categories that the commission approved: treatment, prevention, and recovery. So we were really looking to expand treatment, prevention, and recovery programs specifically focused on opioid use disorder. And so we had several nonprofit organizations, other organizations that responded to that. And so we've been able to work with a lot of what I would characterize as non-traditional providers in communities, organizations like, Girls and Boys Clubs of Alabama, several faith-based organizations that receive funding. And it's actually on our website. If anyone wants to go and see who was funded and how much money they received, they can go to mh.alabama.gov. And the opioid settlement funding information is on the website.
Would you say that website one more time?
Sure. It's mh.alabama.gov. The rest of that $10 million went to the Department of Corrections. So for the first time in our state, we were able to implement medication-assisted treatment in prison. And I honestly never thought in Alabama we were going to be successful in doing that. But Commissioner of Department of Corrections was absolutely on board, John Hamm, and decided that he would partner with us. And so the other $1.5 million of that allocation went to support medication-assisted treatment in prison.
I'm a big proponent of medication-assisted treatment. Traditionally, that was not welcomed at all or even discussed, even at some of the nation's most respected treatment centers. But it makes such a difference. It can. I have also spoken at prisons and jails all over the country, and I see what intervention and treatment in the prison system looks like and the difference it can make. So I personally am very happy to hear that.
Yeah, and there was a phase 2 of the allocation, and one of the agencies that received, I think it was $5 million, was the Department of Bureau of Pardons and Parole, Director Cam Ward. So he is actually putting medication-assisted treatment, mental health treatment, substance use treatment embedded in his day reporting centers. And so the folks who are coming out of prison that they know really need that additional support that are in those day reporting centers actually have the capacity to get that treatment during the day at that day reporting center. And that is huge for Alabama too. We've never seen that level of commitment around mental health and substance use treatment from the Bureau of Pardons and Paroles until Cam Moore became the director. And he has quite a story and really understands that so often, if you don't address the mental health issue and the substance use issue, they're coming right back to prison.
And they're costing the taxpayers more money.
Yes.
And these people can be rehabilitated.
Right.
You know, look, there are 25 million Americans. There are 25 million of us walking around who have been rehabilitated. Now, I never went to prison, but I sure could have. For people who say, we shouldn't spend any money helping these people, they committed crimes. Well, some of the crimes were minor. And so when you help someone, when you rehabilitate someone, they are released back into society, they pay their taxes, they are gainfully employed, and then they go on to help other people.
Right.
So there's a lot of value to it.
Yeah. What Director Ward would tell you is, 95% of the people who are in prison are coming back to your local community. So they're either going to come back in recovery and working on their mental health issues and their substance use issues, or they're going to be a problem in your community. So it is in your interest
yes,
that we help rehabilitate them.
Mm-hmm. Moving on. When we were talking recently, you were telling me about the recovery resource centers that have been opened in the state. If you could briefly tell me how many locations there are, where they are, and what goes on at these centers that help people.
So we're really excited about recovery resource centers. We have 8 across the state. We have one in Albertville, Birmingham, Dothan, Gadsden, Huntsville, Mobile, Montgomery, and Tuscaloosa.
Wow.
And so it's kind of what we call interim services. So someone who has decided they want to go to treatment, they're willing to go through an evaluation, can go to a recovery resource center. We have a particular kind of assessment called the ASAM that everyone needs to go through if they're going to substance use treatment. So those recovery centers can do the ASAM. They can help connect the individual with the supports and treatment that they need. They can also provide some, what I would categorize as recovery support services. So often there are individuals with lived experience there that can help support them as they prepare to move on to a new level of treatment. So often folks have to wait for a treatment bed. And so this is a good way to keep individuals who've made that commitment to go to treatment engaged, help them feel like they're getting started and taking the first step, and supporting them until they can get to that treatment bed.
And waiting. Oh my gosh. When you have to wait to get help, you're probably not going to stick around for it.
Right.
So it is of the essence that people get treatment right away, whether it is mental health. I mean, I hate to be, so negative about it, but when someone has to wait for treatment, they might not make it at all.
Right.
So I think that is so important, that people can get help when they need it and where they need it.
It's such a hard decision for people to make to go to treatment, as you know. It's just, and it's so important once they've made that decision to support that decision, because it's so much easier for them to turn right back to their drug of choice. That is the much easier choice. And so trying to support them in that decision and help them know that they're going to get to where they need to be and that there are people around them who are going to help them is huge.
Tell me about what the state is offering in terms of online therapy, like options on Zoom, etc.
So we do have some telehealth services that we offer. We now really have the ability with the ASAM to do that through telehealth method, and that can be available anywhere in the state. So again, in some of our rural communities, it's like, okay, well, the first step to treatment is we've got to do this ASAM assessment, but there's nobody within 50 or 100 miles of you to get that done. Mm-hmm. And so we have a couple of the resource centers as well as the crisis center that offer people the opportunity to have that ASAM done via a telehealth medium. And then we also have the ability, we recently received a USDA grant where we can also offer some substance use services in our rural communities in the state. And I just feel like that's going to be a game changer.
And where can people find out more about this?
So again, at mh.alabama.gov, if you go under press releases, you can find the USDA press release. We did that probably about 4 months ago, and it'll tell you which counties those services are going to be offered in. So yeah, we're really excited about that.
Thank you to our presenting sponsor, Longleaf Recovery and Wellness. Longleaf Recovery and Wellness is elevating the standard for addiction and mental health treatment in Alabama, offering exceptional and personalized care at centers in Birmingham, Huntsville, and Baldwin County. Life-saving programs offered at Longleaf provide a path to real change and support for a restored life long-term. Learn more about Longleaf Recovery and Wellness at longleafcenters.com. A big thank you to our sponsors, Blue Cross Blue Shield of Alabama and Southern Ketamine and Wellness. When we started this interview, you talked about all the improvements that have been made in the last 4 or 5 years. That's when COVID started. So let's talk for a minute about the impact that COVID has had on people's mental health and their substance use. People during COVID were more isolated. They were disconnected. People's mental health suffered. There was an uptick in substance use. There was an uptick in depression. And it seemed like everything was exacerbated. So if you could just speak to the trauma that people went through, and especially our young people whose parents might have been undergoing financial insecurity, or maybe they lost a grandparent. If you could just speak to the impact that COVID has had.
So the impact of COVID was huge. You know, isolation, honestly, is the worst thing that you can do for your mental health. And, you know, here was this hugely traumatic event for the whole nation, right? Like nobody, you know, got to miss out on the COVID epidemic. Everybody was impacted. And if you think about a big tragedy like that, the last time we had that was 9/11, where everyone was impacted by that. But during 9/11, people had their churches to go to, their friends to talk to. You had a way of connecting with people in this shared experience around this traumatic event that was happening. And so when COVID happened and we had to isolate, it is absolutely the worst thing that could have happened for our mental health. And so having kids who were not learning social skills because they were missing school, having families that couldn't talk to each other, having all these deaths of loved ones. So at a time when normally the thing that you really need to do is to come together and be connected, you had a situation where we had the exact opposite. And so that's really the downside of COVID. And we're still seeing the outcome of that. We're still seeing so many people who are struggling to re-engage and connect with community that are still isolated and fearful.
And I think we won't know the full impact of COVID perhaps for decades.
Right.
We don't know. Let's talk about the impact that this has had on our children and our young adults. Right. I would love to hear about the partnership with Children's Hospital of Alabama. And then I want to ask you about the Children's Pediatric Crisis Center in Huntsville. Okay. So let's start with the partnership with Children's Hospital of Alabama.
Sure. We have a wonderful program with Children's Hospital of Alabama called Pediatric Access to Telemental Health Care. So thankfully, we stood up this program really the year before COVID. We received a grant. And in that program, at first, we worked primarily with rural pediatricians who were seeing kids in their practice that might have a mental health issue. And so the program really connects that rural pediatrician with Children's Hospital in a couple of different ways. First, if they have a child in their practice that needs therapy, that needs a psychologist to do an evaluation, or needs medication and access to a child and adolescent psychiatrist, then they can actually use telehealth to get those services in that local pediatrician's office. And then in addition to that, if the physician has a child in their practice that maybe they just need a medication adjustment, or they're seeing some symptoms, but they're not really sure if it's a mental health issue, then they can connect with the physician's child and adolescent psychiatrist at Children's Hospital and do a consult in order to find out what is the best course of treatment for those kids. And then they also offer some training to the pediatrician and the staff around things like trauma.
Oh my gosh, yes.
Like any of the new issues that are kind of coming up that they're seeing, then they offer that training to both the pediatrician and his staff. Made a world of difference during COVID. Really, we would have been in big trouble if we had not had those telehealth services available for kids during COVID. And that program has been able to expand. I believe it's over 127 pediatricians in our state that are involved in the program now. Wow. So we're also seeing pediatricians in urban areas join that program. And so we're very, very excited about that partnership and think that it's making a difference. So often, what we try to find is that trusted advisor. Who are parents talking to? And we know so often, rather than talk to a teacher or a mental health professional, parents are talking to pediatricians about their child's mental health. And so we want to make that connection with that trusted advisor so that we're not dealing with, well, we're afraid and we don't know what this really is. If we can get that trusted advisor talking to families, then we don't have to deal with stigma, and we don't have to deal with, well, this is denial. I don't want my child to have a mental health issue, so I'm going to, I don't know what that is. I don't know what it looks like. So talking to the pediatrician is huge.
So much of this is based on fear and fear of the unknown. So when you can connect with a provider who has been properly educated, it takes away that fear. Let me shift to the Children's Pediatric Crisis Center in Huntsville. This is the first of its kind in the state of Alabama. Very exciting.
Yes. Interesting model that Wellstone and Huntsville has implemented. They were one of the first community mental health centers to open a crisis center. And they built a brand new building, beautiful building. And when they built it, they knew that they wanted to offer services to children and adolescents. And so they built it so that they could add the pediatric crisis center to the adult crisis center. And so I guess September 16th or 17th this month, that's coming up in a week or two, right?
Yeah.
They'll be opening the crisis center in Huntsville, and it is the first of its kind to be connected to a crisis center. So it really is a beautiful model of how to serve a community, both with adults and with kids. Prior to that, there were 800 kids leaving the Madison County area, going to a hospital somewhere else in the state, which means, of course, the family involvement in their treatment is not as good as it would be if they could be served in their home community. So we really felt like that was a huge need in that area. And so we're really excited about the opening of those services in Huntsville.
It is exciting. And you mentioned the importance of the family involvement. And we need parents to be involved. And it's tough for a family to be involved when treatment is 2 hours away.
Right.
So this will provide that opportunity for the family members and the caregivers, whether it's biological parents or step parents or grandparents or aunties and uncles. We'll give them that opportunity. In the remaining time that we have, which is just a few minutes now, I'd love to find out what it is about this work that you enjoy and what your personal connection is to mental health services.
Yeah, for me, it's not just a job. It is a calling. At some point early, after I was appointed, sitting down, sort of reflecting on it, sort of realizing that everything in my life had sort of led up to the moment that I was appointed commissioner. So all of my life experiences, both personal and professional, I feel like prepared me to be in the role, to really care about what happens to individuals with mental health and substance use disorder. I often joke with people, I'm like, if you knew of the first 18 years of my life, the trauma and other things that I experienced, you would be much more likely to reserve me a bed somewhere than think that I would be commissioner. Yeah, it was a lot.
Well, what would you like to share about that?
I think what I want to share is a story of hope. Really, I was very fortunate in my career. I was working in treatment programs, and I had people who would tell me the truth, because honestly, I came out of that feeling like I was in charge of my life, think I was pretty successful. I had graduated from undergrad and graduate school, had a great job. But honestly, my relationships were not going great because of that previous trauma and some of the things that I had learned, or ways to live in the world that I had learned during that time when it was very traumatic. And I really spent a lot of time looking back going, why is it that, I was able to navigate some of that? And at some point I realized that I really needed some help. This relationship, I was in my first marriage, and within a year I was headed to divorce. And so the pain of that really caused me to evaluate, like, how did I get here? And sort of my attitude about it was, I don't want to do this again. This is really painful. Let me figure out what is going on in my world. And through that, really got involved with some recovery organizations, spent a fair amount of time in Al-Anon. I had been raised to believe in my family that my father was the reason for all of our troubles. And he did have a drinking problem. But I got involved in Al-Anon, got involved in a lot of therapy, still do therapy till this day. And I really had the support that I needed to move forward, in that situation. And so, but when I looked back on it, what I also realized is we had grandparents, we had that, even though there was a lot going on, we had a support system.
Where did your support come from in your family?
We wound up living with my grandparents because my parents were very young when they got married, had 2 kids very soon after the marriage. And so by the time my mother was 23, she had 2 children and on her way to a divorce. And so we moved in with our grandparents. And then we had an aunt and uncle who lived next door, so my mom went to work, and we had what I now realize was this support system that really kept us grounded, helped us feel secure. Things continue to sort of be a bit of a roller coaster after we moved out from my grandparents. So that was certainly a challenging time. And I remember we took a little detour to Chicago. And I remember literally looking around at the age of 7 and going, these adults don't know what they're doing. I need to be in charge of my life.
At age 7, you realized that?
Yes. There was a particular situation going on, and my brother and I made a plan for how we were going to escape the situation if we needed to. There was a Catholic church across the street.
Oh.
And so I was in the first grade, he was in the second grade, and we got our plan together. It's like we're running out that door. Our grandmother made us memorize our phone number. It's like 487-3920. And to this day, I still remember that phone number because she was so afraid of what was going to happen. And my mom was in her second marriage. And so we were going to run across the street to the Catholic church where we saw the nuns, to give them the phone number, and somebody was going to come get us. And so my challenge from a recovery standpoint was, there's someone in charge and it's not me. Like, I had a very strong sense of I'm in charge. I can do this. I don't need anybody. And so the hardest lesson for me, there's a power greater than me.
And that is the primary tenet of the 12-step programs.
Right.
There is a higher power that will help you. For me, that's God. It looks different for everybody, but how courageous of you to have gone through so much trauma at a young age, true childhood trauma that did have a devastating impact on you, but because you have been through therapy, you've participated in Al-Anon, you have dealt with your trauma and PTSD, you have turned it around, and now you are the state commissioner for mental health.
Shocking, isn't it?
No, it's beautiful.
Yeah.
And thank you for being transparent about your story.
Yeah.
Because you just helped our listeners. I don't know anyone who didn't experience some form of trauma as a young person.
Right.
And it's heartbreaking when I hear you as a first grader making an escape plan.
Right.
My heart goes out to you, but look what happened. And now you are helping untold numbers of people.
Right. And the 12 steps are so, and we talked about this. I'm like, if everybody worked the 12 steps, we'd have world peace. If they got serious about working the 12 steps,
I agree.
We could have world peace. And I still to this day struggle with, there is a God and it's not me, because so much of my sense of security was built on, I need to take care of things. I need to be in control of the situation. So even today, from a spiritual standpoint, that is still the thing that I have to work on every single day. I mean, you can imagine, here I am, Commissioner of Mental Health, and there are decisions in front of me every day. And then there's what I think I ought to do, and there's what my higher power, who I see as God, wants me to do.
To what extent do you rely on your faith in your job?
Well, as I've often told people, it's like if I get up and I do my meditation time and I do my prayer time and I get my head straight about who's in charge, my day goes great. But the minute that I don't do that and I don't practice those disciplines of prayer and meditation, it's going to go off the rails every time.
I resemble that remark. When I get out of my head and I think I'm in charge and I forget that God is in charge of my life, I go off the rails too. And there's a lot at stake when we go off the rails.
Yes.
Yes.
Well, even with my staff, we have a daily meditation book. A couple of us do that. And we were going through some things over the last couple of weeks. And, God's sense of humor is always interesting to me. Almost every daily meditation was count it all joy when you face trials. And so
say that again.
Count it all joy when you face trials.
And that's
I'm
tough.
Like, really, God? That's what we're going to do this week. And then somebody would get off track and I'm like, did you read your daily meditation today? Let's read it. Let's just go get it and let's read it.
And so how does that help you be the best commissioner you can be and help others?
It gives me a sense of peace that I absolutely would not have otherwise. It gives me a sense of doing what I am on this earth to do based on what God wants me to do, not based on what Kim wants to do. So with that comes a sense of peace that I would not have. Like, it's not my peace, it's God's peace that he gives to me because I'm in the center of his will. And when I'm not in the center of his will, then I'm not at peace. So.
Love it. Last question for you, Madam Commissioner. What gives you hope about where we are in the state of Alabama and the mental health services that our citizens are being provided?
I think really the upside of COVID, we talked about the negative things, but the upside of COVID is it opened up the conversation about mental health and substance use in a way that we've never been able to have before. The other hopeful thing, and again, I feel so humbled by the policymakers, by the governor's commitment to the mental health issue. We've seen a $102 million increase in our budget during Governor Ivey's tenure. And a lot of that has to do with her commitment, as well as our legislative leadership. Speaker Ledbetter has been a phenomenal champion. And it's because he listens to his constituents. And when they come to him and say, I lost a family member to substance use, or I lost a family member to suicide, he takes that to heart. Our Chairman Reynolds and others who've worked in the law enforcement arena and see every day the impact of that. We are so fortunate to have policymakers because it takes everybody. I can't be successful, our providers can't be successful unless we have everyone on the same page. And for the first time in a long time, I feel like we have policymakers, the governor, our providers, all on the same page, working in the same direction with an absolute commitment to doing something to improve access to mental health care and substance use in our state.
And we can do together what we cannot do apart.
Amen.
Kim Boswell, Commissioner of the Alabama Department of Mental Health. Thank you so much for joining us today. We really appreciate it.
Thank you.
Thank you for listening to One Day at a Time, a Yellowhammer News podcast presented by Longleaf Recovery and Wellness. Be sure to follow Yellowhammer News on Instagram, Facebook, and X. And follow me, Laurie Dhue, on Facebook and Instagram.